Good evening, Northwest Indiana. Hammond Mayor Tom McDermott Jr. here to give you the latest update on COVID-19 epidemic raging across our state, our country, the world we live in. Every Monday and Thursday, I have a meeting of a task force in Hammond called the Coronavirus Task Force. We've been meeting for weeks now, and we usually do these at least once a week. So I wanted to give you the once a week update to share with you where we are on the curve, give you some facts and information from medical experts that we're working with, and just sort of, so let's just jump into the facts, if you don't mind. We got our newest totals from the state of Indiana today, and one area, first off, social distancing is working. The question is where we are in the curve, but I think most people agree that we're towards the top. Hopefully we're at the peak and we'll start to see a drop. However, that doesn't mean it's time to let your guard down. And that's why we're having this conversation today, just to let you know what's going on in the world that we live in. For instance, testing, which is, at this point, we've tested 44,500 and change Hoosiers. There's 6 million people that live in the state of Indiana, and we've only tested 44,539 to be accurate. In the last 7 days, we've tested 18,350-ish Hoosiers in the last 7 days, which is 2,621 Hoosiers a day. The reason I'm mentioning this to you is because Asian countries that we're dealing with this, South Korea being one of them, China also, when dealing with this crisis in their countries, they were testing 4 times as many people a day than we are testing in Indiana. They were testing over 10,000 people a day in these countries, and we're testing 2,621 a day in Indiana. That's a reason not to let your guard down right there, because there's plenty of more people out there that are positive for this virus that are not showing symptoms. So don't let your guard down. To give you an idea about our neighbors to the west, Illinois, and how many they're testing, I was watching Governor Pritzker yesterday was very happy but challenging his staff to get up to 10,000 tests a day. They're currently just shy of 8,000 tests per day in Illinois, which is almost 3 times higher than the rate that we're testing in Indiana. Now, I don't believe in keeping our head in the sand. I believe in getting these tests and getting these results out there so that we know who has the sickness, who's been exposed to it, and getting a true, accurate picture of what's going on. I fear that we're not getting that right now in our state, and we're testing at a fraction of what our neighbors to the west are testing. They're literally testing 3 times as many of their residents per day than we are in Indiana. 44,000 people in Indiana, which is, Hammond has twice that population, and there's 6 million people that live in this state. The number of positive cases increased 67% in the last week in Indiana. The number of positive cases in Indiana increased 67% in the last week. Another reason not to let your guard down. Deaths. We have, in the last 7 days, Indiana has 211 fatalities, unfortunately. 211 families that were devastated by this disease, 211 people that probably had to die alone for fear of other people catching this disease. That's a 152% increase week over week. So if we're in the peak, if we're not in the peak, this is devastating to our state still, and we don't even have a real accurate picture because of the lack of testing that's happening. I could tell you in Hammond, even for first responders, we're waiting days to get our results back. And first responders are high on the list of priorities. So, keep that in mind when you're going to the grocery store. Keep that in mind when you're letting your kid go out and play. The fact is, we're surrounded by asymptomatic carriers that are carrying this disease, and that's something we all have to keep in mind. So anyway, now is not the time to relax. If we relax too soon, it's going to surge back up. And we've been using the same chart from Johns Hopkins University from the beginning of this, so I'm going to ask my tech support here to pull up that chart so that I could show you. This chart is basically daily deaths with coronavirus on a 7-day rolling average. So this is a chart of daily deaths. Is it up now? So it's up now, and as you can see, the top of the list there, and over almost 2,000 deaths per day is the United States of America, which is the country that's most affected by this virus. Obviously, what's going on in New York, which happens to be the hot spot for our country, but make no mistake about it, Chicago is closely behind, New Orleans, Detroit, other areas. Obviously, we all know about Washington. And there are parts of the country, like San Francisco, for instance. Lake County, Indiana has more deaths than San Francisco does. And it's because in San Francisco, they enforce social distancing, they enforce shelter in place, and they did it early. And it appears that it's been successful in places like San Francisco. And you look at other parts of the country where it has not been as successful. But anyway, as you'll see in this chart, the United States of America is leading the world with daily deaths from the coronavirus in a large way, actually. Italy is on the way down. Spain is on the way down. France appears like it's about to turn on the way down. The United Kingdom doesn't look like it's going down, but it's certainly not going anywhere near where we are. So what does this mean? This means that we need to be vigilant about social distancing. We need to be vigilant about shelter in place. We need to be vigilant and not let our guards down. So if we are coming to the peak, it's because we're doing our job well. And the moral to the story, the reason I'm on this show right now, is to inform you and to keep in mind that we need to be vigilant about this. During the shelter in place, unfortunately, through the Hammond Police Department, we see a lot of domestic violence situations. Unfortunately, drug abuse, alcohol abuse has gone way up. Unfortunately, suicides are up during this period as well. Child abuse calls are up as well. I guess, unfortunately, this makes sense with all of us being cooped up in our house. It unfortunately brings out the worst in some people. And we wanted to put some numbers out there because if you need help, you need to speak to somebody. There are options for telemedicine and for teletherapy. Teletherapy and telemedicine options that we want to give to you. First off, Purdue Northwest for teletherapy. Purdue Northwest has a number to call, 219-989-2923. There, and then Regional Mental Health, I see that number's up there, 219-789-4000, 769-4005. And then we have Franciscan Step 1 Counseling, which is 800-783-7663. So there you go. So if you need help for telemedicine, teletherapy, those are 3 numbers available to you. Now, we talked a little bit earlier about how Illinois is testing 7,900 people a day on the average, and we're testing 1/3 of that here in Indiana. We had a meeting this morning with our first responders and with the hospitals, and we're trying to put in perspective how many residents of Hammond are positive for COVID-19. And we've worked through the Lake County Health Department, and it's real hard to track down this information. We've worked with our local hospitals because if you're a resident of Hammond, some go to Franciscan in Hammond, some go over to East Chicago, some go down to Community Hospital, some will go to Chicago. So it's hard to keep track of how many COVID-19 positive patients are in the city of Hammond. However, I can confirm a number as a minimum number of people in Hammond that are positive for COVID-19. There are over 60 cases in Hammond of residents positive for coronavirus as of this moment. That's a minimum, because of the testing problems we've had and because a lot of people could be asymptomatic and could walk around spreading this virus and not even realize it. 60 is what we can confirm. There are likely hundreds of more people that are walking around. They could be in the grocery store with you. They could be in a drive-through with you that are carrying this virus. 60 have it for sure in Hammond. How many more hundreds are asymptomatic and are going to get sick or possibly not get sick at all is anybody's guess. We won't know this until we start fixing our testing problems. But 60 of your residents, for a fact, are positive for coronavirus, and that's something you should keep in mind when your kids ask you if they can go to the skateboard park, which is still happening way too much. Or when your kids want to go out and play with the kids from down the street, those kids could be sick. Their parents could be sick and they could have given it to their kids. 60 confirmed cases at a minimum in the city of Hammond right now, likely hundreds more. This morning we spoke with the hospital, Franciscan Health Hammond, and I wanted to update you on a couple things that are going on there right now. We did a commercial a couple weeks ago with St. Margaret's, and they were talking about a triage unit that they were going to build outside of the ER, anticipating this surge that's coming in. The good news, I guess, is they still have not built that. They still feel like they have the capacity in Franciscan to be able to handle this surge, and at this point, that triage unit is not under construction. I guess that's good news. It's on hold. If it becomes necessary, they're going to move forward with that. However, this is sort of depressing when you think about it. Each hospital has a morgue. Community. All the hospitals have morgues in it for when patients unfortunately don't make it. And if those morgues become full, they have to get temporary coolers to act as temporary morgues until they can catch up. And St. Margaret, Franciscan Health Hammond, is no exception. They are running into capacity issues with their morgues, and they're looking to fill in extra capacity with coolers. That's something that's being considered as we speak, unfortunately. I asked the question of the hospital representative today, who is your typical patient that's coming into Franciscan Healthcare Hammond? And they said the hospitalized patients that come in with this virus are typically in their 40s to their 70s. The average person that comes in is in their 60s. And they wanted to reiterate a couple things. And we're doing well in this regard, which is why they still have capacity at Franciscan Health Hammond. But if you're not dying, if you have an ache and pain and you don't need to go to the hospital, do not go to the hospital. You're putting yourself at risk by being there. Do not go to the hospital unless you are sick with COVID-19 and you're struggling for breath and you're exhausted and you can't even barely breathe anymore. Go to the hospital. Go to the hospital if you have an extremely high fever. When I say extremely high fever, if it's over 101, go to the hospital. So these are, by the way, with that fever, without acetaminophen, without Tylenol. If you, without using medicine, are at 101 or above, you consider going to the hospital, especially if you're having breathing problems. If you're not below that, if you're in the 99 area, if you're in the 100 area, stay home. You're putting yourself more at risk by going to the hospital in cases like that. If you don't have breathing issues, stay at home. I was informed there's a number of COVID-19 patients sheltering at home with using telemedicine with the doctors at Franciscan Health Hammond. And that's even if you don't know if you're positive or not, maybe you just have a fever, stay at home until it becomes unbearable. Your fever is unbearable, it's too high, you're having breathing issues, then you got to start talking about going to the hospital. Like last time we spoke with you, we spent a long time on this morning's call talking about apartment complexes, talking about nursing homes, and long-term care facilities. We have a number of these facilities in the city of Hammond, and these areas are of particular concern to my administration, to the Lake County Health Department, to the Hammond Fire Department, Hammond Police Department, Community Development. We have all made sure that we're in constant contact with the leaders of these facilities, making sure that they understand there are things that they need to be doing in these buildings right now. And now, if you're one of the people in charge of these long-term care facilities and you're watching right now, or if you live in one of these long-term care facilities and you want to know whether or not the management of your building is operating properly, I went through with medical experts today and I said, Mr. Medical Expert, if you were in charge of one of these long-term care facilities in Hammond, what would you insist upon being done to make sure that these places don't become rampant with coronavirus? And this is what we were told to remind you of. First off, there's group homes in Hammond with positive cases, absolutely, for sure. Positive cases where our fire department has actually had to go in and pull people out and bring them to the hospital, and they were found to be positive. Now, these are high-density homes, and if you live in them, there are positive people living amongst you right now, And not only that, there are asymptomatic carriers surrounding you that may get sick within the next few days, and they may not get sick, but they're spreading that disease as we speak. So keep that in mind. We've pulled positive cases out of our local developments. There are multiple, I already hit that one. So what do we do if we live in these facilities? Obviously, you must adhere to social distancing. It's a must. You cannot fraternize with anybody. You cannot hang out in common areas with other people. You cannot visit other people's apartments in these buildings. You literally have to lock down and hunker down in your apartment. Elevators. Be particularly careful in elevators. Try to ride alone in elevators. Try not to touch with your fingers, and of course, use hand sanitizer when you get back in. Restrict the number of visits. If you're in charge of these facilities, restrict visits altogether or restrict them to medical personnel only. But you look at nursing homes on the West Coast when this was wreaking havoc in the Seattle area, they locked down the nursing homes. You couldn't visit mom or dad or grandma or grandpa if you wanted to for their own safety. We still find in our city some of these facilities that aren't run by the city of Hammond are letting people come and go even as of last week, which is unacceptable. It's going to explode into a major problem if we don't start clamping down on this, which is why we as a city, made sure that the Lake County Health Department was aware of these problems, and I appreciate their help with this situation. Everybody in these facilities must wear masks. Must wear masks. Everybody you see in these facilities should be wearing masks. All deliveries being brought into these facilities must be done in one central location. So if you're getting an Amazon package, the Amazon driver, who could be positive, can't run up to your apartment and drop it off and then run back out, maybe possibly exposing an Amazon driver, or if the Amazon driver is sick, exposing everybody that driver comes into contact with. All deliveries into these facilities should be dropped off in one place, and the resident comes down to that one place to get the delivery. Sanitize everything. You should smell chemicals when you go into these places. All flat surfaces, all doorknobs, all light switches. Everything should be sanitized in these group homes. Hand washing. Absolutely, we've heard it. When I was talking to nurses this morning, they talked about hand washing. Every time I bring up a subject, they'd be like, you got to wash your hands. Wash your hands, wash your hands, wash your hands. Isolating. What happens on a ship when people get sick? You hear about the people that were on the cruise ships. The captain wouldn't even let them out of their little rooms. And those are little rooms. And the captain would not let them walk around the ship and spread the disease. Locked them in their rooms. So, ideally, if I were in charge of these facilities, if I were in charge of the Renaissance or another one of these high-density housing complexes, ideally, people wouldn't even leave their rooms. That's an ideal situation. I realize that's not always possible because these people rent and they have leases and that's their space, but ideally, they shouldn't even leave their room. Hand washing. Build up the immune system. It's something that I heard from the nurses and I thought was great. Build up your immune system, taking vitamins, vitamin C. I know in China, I have a doctor friend of mine, Dr. Mike Forright from Comprehensive Care, has always believed in vitamin shots. Literally shots into your body of pure liquid vitamin. And I tell you, I realize not a lot of people could get that, but taking vitamins, making sure your immune system is strong is going to help you tremendously during this virus. Get fresh air. You can go outside and walk. You can go outside and ride your bikes. That helps you. Get outside by yourself, maintain social distancing, get some fresh air. Vitamin C, that goes back to what we talked about earlier with the immune system. And another thing I thought was interesting to hear from the nurses at St. Margaret's, lots of water. Stay well hydrated, and it will help you with this virus. As a reminder, I wanted to remind everybody, currently, April 13th, 2020, in the city of Hammond, where we are currently, just as a reminder, City Hall is closed to the public, but we're still doing our jobs, okay? If you have issues, you can call the mayor's office at 219-853-6302. We're still picking up items when you call through Public Works. I wish I had their number off the top of my head, but I don't. But if you want to call the mayor's office, we'll forward you there, okay? We're still picking up your trash. Republic Recycling is still picking up your recycling on your scheduled date. We're police and fire, obviously, if you need to reach them, call 911. Hammond 311 is still operating. So if you want to use Hammond 111, you could do it, Hammond 311. You put it in there. We're still following through with our work orders in that regard. So even though you cannot walk into City Hall or any other city building right now, our employees are here. I'm here right now in my tie because we're working. We just can't have the public come in and get us sick so that we could do our jobs for you, okay? Retail businesses, per the governor's orders, are only open if essential. And if it's essential, like a grocery store, limited to who can enter, per square foot kind of calculations. If you're in one of these essential businesses, let's say like a Meijer or a Walmart or a Walgreens or a CVS, you have to wear a mask. You must wear a mask, and you must comply with social distancing. Per the governor's order, these essential businesses are allowed to be open as long as they adhere to the social distancing requirement, the mask requirement, and not to have it too densely populated so that there's only one person per every thousands of square feet, all right? Non-essential businesses, I think of liquor stores, things of that nature, right? Non-essential businesses are not open to the public. However, they can be open for call-ins or curbside pickups. So, for instance, Nick's Liquor. We'll give them a little commercial here. I drove by Nick's Liquor the other day, and people are not allowed to go into Nick's Liquor. So Nick's Liquor would bring the alcohol out and conduct the transaction in the driveway. It was causing traffic issues because the line was so long, but that's how non-essential businesses are being forced to operate during this pandemic, is only open for call-in with curbside pickup or delivery. Currently in the city of Hammond, April 13th, 2020, all park facilities are closed. All of them. Skateboard parks, closed. Playgrounds, closed. Sportsplex, Gene Shepherd Center, closed. Closed. Senior Center, closed. Civic Center, closed. Everything indoor is closed. The only thing your kids could do outside, unless they're in front of your house throwing a baseball or something like that, is go on the trails. Everything else is closed. Now, what happens if a Hammond police officer goes by and sees your kids in the skateboard park? They can be ticketed. We've warned people way too much already, and it's still happening. Eventually, we're going to just start ticketing, and your kid could bring home a ticket to you because we cannot keep on doing this. We've talked about it too many times already. Lori Lightfoot, mayor of Chicago, when this situation got too bad, she shut down the trails. And I don't want to have to do that. That's literally the only place we could be right now is out in the open on the trails. And we're hoping we could avoid that. So the trails are open. You must maintain social distancing. Park facilities are closed. And obviously, the Lost Marsh Golf Course is closed. April 13th, 2020, we had a lot to tell you. I hadn't spoken to you after my last meeting of the Coronavirus Task Force in about a week. So unless something drastic happens, the next time I give this presentation will be next Monday. If something, material happens between now and Thursday, I'll be back on the air Thursday. But if it's just normal, same kind of stuff we talked about today, I won't be back on until next Monday. Thank you all again very much. Remember what the doctors told us. Maintain your social distancing. Wash your hands. Build up your immune system. Take vitamins. Stay well hydrated. And be vigilant. We're going to get through this, Northwest Indiana. We're going to get through this as a country, as neighbors. We just got to be vigilant. We're at the top part of the curve. If we stay vigilant for a couple more weeks, we can start to relax some of these measures. Again, this is Hammond Mayor Thomas McDermott Jr., April 13th, 2020, with the latest update on the Coronavirus Task Force. Thank you.